Here on the Town Hall, we turn to our Verify team to separate fact from fiction, especially when it comes to the vaccine. And often we are debunking stuff that you read on Facebook or Twitter.
That keeps us pretty busy. Tonight, though, we're getting to the bottom of an opinion article that was printed in a very reputable newspaper. We'll have herd immunity by April. That's the bold prediction from Dr. Martin Makary, a professor of surgery at the Johns Hopkins School of Medicine. His Wall Street Journal op-ed projects COVID will be mostly gone by early spring. So let's verify. Do experts agree that we'll reach herd immunity by April? Our sources, 5 different infectious disease specialists.
If we plan for the fall and it winds up being sometime earlier, then we can celebrate.
April is very optimistic. It's unlikely.
I think there is no chance we will have herd immunity by April.
No, it's not possible.
Some experts have argued at least 70% of Americans need to be fully vaccinated to reach herd immunity. Today's vaccination data from the CDC puts the percentage around 8%. But Dr. Makary's op-ed argues natural immunity from infections may get us there sooner. He claims 2/3 of Americans have actually had COVID, and roughly 55% of the country still has natural immunity.
Everything was incorrect.
Dr. Ali Mokdad disagrees. He's a professor at the University of Washington's Institute for Health Metrics and Evaluation.
What we do is based on numbers. We're data people.
He points to CDC surveys that show only 20% of Americans have been infected, and he predicts around 20% will be fully vaccinated by April.
Best case scenario in the United States would be around 40%. That's not herd immunity. This is not amateur hour.
Dr. Saad Omer is director of the Yale Institute for Global Health. He also questioned the op-ed, saying there's no way to calculate natural immunity at this point.
That's not the appropriate interpretation of data.
He says most experts aren't going around making bold predictions because there is genuine uncertainty, which gets to a key point of contention. What's causing the current decline in cases? Dr. Makary argued in the op-ed that the only explanation is natural immunity from infections. But Drs. Mokdad and Omer say it's actually human behavior.
Americans did what it takes to bring this pandemic down.
Their data shows mask wearing is way up and travel is way down.
There is substantial impact of voluntary response. The lockdown and the behaviors did it.
Our experts all agree cases and deaths should keep dropping, especially with warmer weather coming, and we may see looser restrictions as a result. But they say that could reverse quickly with new variants.
All this success story that we see right now is so fragile. It's so dangerous to talk about herd immunity in April and in May, simply because we have new variants that are making the vaccine less effective.
Dr. John Selleck with Kaleida believes fall is the most reasonable expectation on when enough people will have full protection.
The thing that we don't want to do is tell people, oh, everything is going to be great by April or going to be great by July. And then if it's not, then we have to walk that back and say, okay, what went wrong?
So we can verify many top experts do not agree with that widely read op-ed that will reach herd immunity in April.